Good afternoon, everybody. And welcome to the workshop of the Board of County Commissioners meeting. Would you all please rise for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, first thing on our agenda today is our update with Mr. Theine and SHS. Come on down.
Great, thanks for having me. You'll see just some updates on things that we've been talking about over the last year. I'll start by saying the hospitals reached a really nice spot in terms of financial stability for the moment, and I'll talk a little bit about tailwinds and headwinds with things that are happening at the federal level, but we've put ourselves in a good position to have a runway to prepare for that. So with that, Travis, if you want to advance, a couple things we'll look at is where we're at today, some updates on our longer term plans, and then, like I said, some forward-looking thoughts. So this is looking back over the last 4 years now, and this is our losses or gains from operations. So it doesn't take into account the sales tax revenue coming in or some other non-operating revenue and expenses. And as you can see in 2024, these are now our audited financials, had an operating income of $1.7 million. Going back over the last many years, we're operating at a loss. And really pleased to share that this year in 2025, our operating income already exceeds what it did for all of last year. So that momentum is behind us and kind of pushing us forward. Go ahead. Really, what's driving that primarily is more people choosing to use the hospital, and then some great work we've done on staffing and increasing retention within our staff. You've seen a similar look at this before. So the blue bars are what we forecasted our growth would be by different services, and then the beige bars are what's actually occurred year to date, and this is through May of this year. And I've pointed you in the past to adjusted patient days. That's all the activity in the hospital, not the physician clinics, but all the activity in the hospitals rolled up into one. And you'll see that we plan to be growing the hospital by about 4%, and we've actually grown it by 5%. So again, growing faster than what we forecasted. You can see a little bit of variation with some services, but most services are growing faster than what we planned already. Go ahead. I mentioned that on the cost side, the other thing that's helping us out is our retention rate, and this is looking at all of our employees. If we looked at nursing through the end of last year, we had over a 90% retention rate for our nurses, which is where a fair amount of itinerant labor can come into healthcare at a relatively high cost. So I'm really pleased with the nursing leadership and what they're doing. The last couple months, what you'll see in terms of some higher numbers, some of that relates to as needed employees, people that work on a PRN basis. If they don't work for a period of time, at some point we say, we're just going to take you out of our payroll system. And so we just cleaned up some things for employees that hadn't worked in over 6 months or a year, so we're just as needed. So really just reflects some one-time things in the data, but our retention still continues to be relatively good overall. I've shared this slide with you several times. It's just a reminder that most of the revenue we expect to collect comes from taking care of patients. We have a small amount that's the sales tax, which really helps us cover the bond debt that we have, and a little bit from philanthropy. And of that cash that we expect to collect from caring for patients, 17% of that comes from Medicaid. If we include the provider fees that get matched at a federal level, that actually jumps up to 24% of our total cash that we expect to collect. So Medicaid and that funding still is something we're paying a lot of attention to given some of the federal legislation.
So I've got a quick question on that,
Yeah.
Joe. Last Monday at our coffee with the county, we had, I don't even know who it was, but somebody had stated, I think, Commissioner, like 33 or 34% from Medicaid, and that doesn't show that here. It is the 17%, correct?
Yeah, there's a couple ways you could measure it. If you looked at patients coming in the door, it would be higher. This is looking at the cash we expect to collect. And Medicaid is, one of the lowest payers on a per unit of service basis. So the number of people we care for is higher. The percentage of revenue that we get is lower.
that we expect to collect
Yep.
is the 17%. So that's what you're still using for a number.
That's what we planned for this year.
So we were correct.
Yeah.
Because we heard that number and we were like, nah, I don't think that's correct. But anyway, all right. Go ahead, thanks.
This is where we plan to use it, most of it from operations, some for capital, and then a good chunk to retire debt, whether it's through the bond debt or equipment we purchased in the past. And then just a note, we are planning to move the electronic record that we use in the physician clinics to mirror the hospital at some point. So we've reserved cash for that transition as well. We're still working through the details and timing of that. It may be later this year or next year, but still expecting to do that. Days cash on hand, we continue to be growing cash. The bond debt that we have today requires us to have 60 days of cash on hand. We can include monies from the Capital Infrastructure Fund and other things, but we're really measuring our cash without that money that's for the infrastructure. So when we pull that out, we have effectively 84 days of cash. We know we've got some things where we either have a payable out or have some planned capital expenses coming up in the future. When we pull those things down, we're still well above 60 days. You can expect over the next couple of quarters, we likely will actually see cash going out the door for some of those things, so just don't want you to be alarmed. Our goal isn't to hold cash just for the sake of holding it. Obviously, we want to be prepared to weather some things in the future, but also have some plans to put that to use this year. Go ahead. So again, our board adopted some overarching principles to guide the organization and objectives. The first being to improve the health of people who are part of the communities we serve, and the second is to treat emergency or urgent conditions for people who live, work, or travel through. And then we've talked about where the funds come from. And Travis, go ahead. The way we're focusing on that is really investing in our people, creating a great place for people to work. When people have a great place and are engaged, we'll deliver safe and high quality care, which allows us to grow, which allows us to reinvest in the services in the community. So that's the underpinning of how we're focusing our efforts. Go ahead, and I'll give an update on a couple of those high level things. So one of the ways we're internally measuring as a proxy for people's health, what impact do we have, is how many people have a primary care physician or advanced practice provider that they've seen and are actively being cared for by. And as you go month by month, what you'll see looking back almost 2 years is that for a period of time that was declining, and then around December and going into this year, we've started to see an increased number of people that have an attributed primary care provider at Southwest Health. This is one of the ways we're looking at our impact on improving people's health. The next two slides are going to touch on access to emergency care. So there's a national standard for coming into an emergency room and not leaving without being treated. And there's a variety of reasons why somebody may leave. The national standard is for that to be less than 2%. And again, we're tracking and monitoring and paying attention to that. And overall, we do very well, with most months being well under the national standard and very rarely above. And then the next slide looks at admissions and transfers. So once somebody presents to our emergency room, we're looking at how we can, if somebody does need to be admitted to the hospital, make sure that they have every opportunity to stay in our community if there's a service that we provide. And so there's some things we're starting to look at in future investments and ways that we can operate to actually increase the care inside the walls of the hospital. But want to make sure that we're both available for people in an emergency, and then if that emergency leads to needing to be in a hospital, that they don't have to leave the community for that hospitalization. One of the areas we've been focused on this year is increasing visits in Mancos. So prior to the beginning of this year, we operated Monday through Thursday. We didn't have availability on Friday. And we also didn't offer any prenatal care in Mancos. And so in the first quarter of the year, we started opening on Fridays. Through the work of our foundation and donations from the community, we were able to purchase an ultrasound and start doing prenatal care with one of our family medicine OB physicians on Fridays. And so we had a goal of increasing the amount of visits. If we continue at the rate that we're running at right now for care delivered in Mancos, we're likely going to not just meet but exceed what we plan to for this year. So really proud of the work the team's doing to expand care in Mancos right now. If you go to the next slide, you'll see it's just a trend of visits by month. And again, there's ups and downs depending on vacations, number of days in a month, things like that. But overall, we're starting to point to an upward trajectory. Two areas that we've really been focusing on from the specialty side are cardiology and oncology, and I'll share with you a little bit of information about each. The punchline is we're not growing the cardiology piece as quickly as we thought we might this year, and we're growing the oncology piece faster than we thought we would. So, you know, plans are great, and then as you start getting into them, things happen. So one of the ways we wanted to expand cardiology was for testing that needs to be done. We offer echocardiograms, stress tests, Holter monitors, EKGs, a variety of things. And in order to help facilitate that, we've entered into a relationship with Montrose Regional Health. They're providing our community with a cardiologist. We're in the process collectively of recruiting a full-time cardiologist and a full-time nurse practitioner that both will live and work in the community. In the interim, about once a month right now, we have a cardiologist here for a week or more at a time. We believe that having a full-time cardiology presence will lead to more of that testing being done locally rather than people driving to Durango for the same service. We haven't seen that yet. The outpatient cardiology piece is really getting stabilized this summer. Montrose has recruited a full-time nurse practitioner already, in addition to the itinerant physician coverage, and then again, still looking for a full-time physician to live and work in the community. So we haven't seen an increase in cardiology testing. We expect that that's going to continue to go up over time. And then the next piece is on oncology. So we've been working really closely with the team at Mercy and really proud of how they have stepped up. Earlier this year, all of the physicians and nurse practitioners from Mercy came over, visited our infusion center. Some of the oncology service line leaders from Denver flew down and visited. And we really had a simple ask. If you see an environment where you would trust us to care for your friend or your family member if they lived in Montezuma County, please refer the patient to us. If that's not what you see when you come visit, tell us what would need to be true and help us get there. And shortly after their visit, both of our clinical teams on the nursing side and the provider side have been communicating really well. We've been seeing an increase in the number of patients that are coming to us for chemotherapy in our infusion center, and all 4 of the providers are regularly referring patients to Southwest Health. And we didn't expect to be growing our oncology service line when we were planning out for 3 years. We were thinking this was going to be somewhere in years 2 and 3. But again, really proud of the work that is transpiring between our hospital and the hospital in Durango to help people stay local for their care. And then I continue to highlight how important it is for all of us to work together. I think especially with what's going to be coming in terms of some headwinds from the federal budget that passed, or the One Big Beautiful Bill. It just reminds us that we all can do things to contribute. So again, choosing to get care at the hospital is one of the big tailwinds, and the more people choose to get care at our hospital, it allows us to have the revenues to maintain the services we have. Just want to highlight a couple of headwinds and then some of the tailwinds. Most of the headwinds don't come for a couple of years. So later this year, there's some chance that Medicare reimbursement may go down. If you're familiar with the PAYGO provisions of the federal budget, the federal government can sequester funds, and currently they actually sequester 2% of Medicare payments. That could go up to 4%. We'll see if the feds carve out Medicare from that PAYGO provision. And then the next thing that really comes isn't until 2027, which is when work requirements are likely to start affecting enrollment. We're not sure what that will look like. And then in 2028, some of the provider fees where states have money matched by the federal government start to get reduced. So when we're looking out into the future, we've got a couple of years for us to continue to grow the hospital to be in a financial position to start weathering some of those cuts. Unrelated to Medicare, if the federal or Medicaid, if the federal government doesn't act before the end of the year, some of the enhanced marketplace premiums will start to go down or go away in Colorado. So the Division of Insurance, I think last week or the week before, announced that if those are going to be in place or not going to go away next year, the premiums on the individual marketplace in Colorado will go up by 28%. And so We're nervous in terms of what that may do for people that rely on those tax credits to be able to purchase their individual insurance, and we may have more people that are uninsured, not just because of changes in Medicaid in the coming years, but because of the sunsetting of that enhanced premium tax credit. So we'll be paying attention to that. On the tailwind side, again, in addition to taking care of more people, the plans that we have around cardiology and oncology are going to be two places where we think we're going to have a lot of tailwinds to help us prepare for the future. And so as we're balancing those things out and planning for the next year, we're in the beginning stages of our budgeting. We're planning next year to be a little bit conservative, but still a year of growth where we're taking care of more patients. We're also looking just closely at our capital investments, and we'll be maybe just a little bit more thoughtful about keeping a few extra dollars in the bank versus spending it on capital next year. But those are kind of the ways that we're thinking about just the next 12 to 18 months. And then as we start to learn more about impacts from work requirements, enrollment, and other things, can assess our financial conditions a little bit later in the future. So that's where we're at. Happy to answer other questions.
Any questions at all?
No, I really don't. I appreciate you coming in and giving us this. I hope that it settles some things that are out there in the community. I really do, because there's a lot of traffic on the internet. Let's just say social media. There we go.
Yeah, there's
And a lot of it's not true.
Yeah, it's understandable when you look at a lot of the headlines that, there can be some fear and some concern, and in the short run, I don't have it. When we think way out into the future, depending on the balance of the headwinds and the tailwinds, things could get challenging.
Yeah.
And not just for our hospital, but, for all hospitals and communities.
Okay, and I don't have anything else at this point in time either, Joe, so
Well,
thank you.
Thanks
I
for the
appreciate it.
opportunity to keep you all updated.
Thank you.
Yeah.
Thank you. You may have some people come out to your next board meeting because we did get hit with a lot of questions that dealt strictly with the SHS, that obviously we don't have any oversight, we don't manage, we don't control, so we just advise them to get to your board meetings, and that way they could ask the questions that they needed to.
Absolutely.
All right.
We'll look forward to it. Thank you.
Thank you, Joe.
Thank you.
Thanks, Joe.
All right, next up, we're looking at a gas line project and a sheriff's office light fixture. Dustin, come on down. Looks like you've got two.
Good afternoon.
Good
Dustin.
afternoon.
So this, the gas line is to deal with that gas leak that Atmos discovered in the middle of May. I contacted a lot of plumbers. They're either too busy or too big of a job. I did get 3 to come out and look at it, but this Montezuma Valley Plumbing is the only quote that I've received back. And I'm just worried that it's gonna get on winter time and we're not gonna have any gas for the heat over there.
Okay, this is, it's under $11,000. Is this because of procurement, Travis, or we can approve this?
Well, I think it just needs to be approved because it's not in the budget.
Okay. Well, but this was because of the gas leaks that we had over there a month ago or whatever? Okay,
Almost
got
2
it.
months ago.
Okay. That's easy. Next.
And then these light fixtures are for the detention center showers. We've been working in there. I bought some a few years ago, or like one unit 1 year, another unit the next year. That company no longer carries these light fixtures, so I scoured the internet finding something similar. And the one company will sell direct, and the other company wanted it to go through an electrical contractor. And that's the only 2 quotes that I can get.
Ten,
Just-
2, and
just because
11.
of that, where it's at, it's gotta be vandal proof and
Ye-
damp.
Absolutely.
for
So
what
these are all
conditions.
coming out of capital anyway, Travis,
Yeah,
right?
yeah,
So,
it'd be for that remodel project or whatever we called it, so.
What type of fixture are they? The LEDs or?
Yeah, they're a 2-foot LED for most of them, the showers have one 4-footer and then the rest are
Okay.
2-foot. But they're like a 16 gauge metal housing with a polycarbonate cover over the LED portion of it. They have replaceable drivers and replaceable trip. So
Kind of indestructible.
Well,
They'll
they're,
figure a way.
they're in a detention center.
it's
Yeah.
kind of
Nothing is
amazing what they can
indestructible.
break with
Yeah.
nothing sometimes. So,
Okay.
Right.
Pretty
Thanks,
straightforward.
Dustin.
all right.
Thanks. All right, Travis, we're gonna look at a PAB next. So we have Mr. Sanders. Come on down, Rachel and Lisa. Come on down.
Good afternoon, Commissioners. Drew Sanders, City Manager, City of Cortez. I'm accompanied this afternoon by Rachel Marchbanks, who is our Community and Economic Development Director, and Lisa Bloomquist, who is our Housing Coordinator. As you mentioned, we're here to talk about the private activity bond, and we have some information to share with you and a request at the end of that. So I'll turn the time over to Lisa with your permission.
Thank you.
Good afternoon, good afternoon, Commissioners. My name is Lisa Bloomquist. I'm the Housing Coordinator for the City of Cortez, and private activity bond financing is a crucial part of eligible housing, financing eligible housing projects. And we are requesting at this time that Montezuma County carry forward the $1.7 million PAB allocation. So the choices are either carry it forward so that it can be used in the next 3 years, or relinquish it to CHAPA or another eligible jurisdiction, or do nothing and the PAB will revert to the state. We would like this money to stay in the community and be available for use for eligible purposes within the community over the next 3 years, and so we are requesting that you carry it forward and not hand it over to CHAPA, another jurisdiction, or the state. The City of Cortez is working with housing developers, workforce housing developers, to build housing on the old Montezuma Cortez High School site that's located on 7th Street in between Chestnut and Oak. No dirt has moved. The plans are very preliminary at this point, but we would like to preserve the possibility of using the $1.73 million of PAB allocation for that project once it gets a little bit further along in its development. There will be a resolution that will be presented to you tomorrow that was created by the attorneys at Kutak Rock. I believe that Mr. Anderson can probably answer questions, more questions about that resolution and the relationship with Kutak Rock, but it is my understanding that they provide services to the county to carry over funds at no cost. So we would just like to keep options open and keep that money in the community.
All right, thank you. Travis, you have anything else to add to that?
No, they actually explained it very well. Thank you. We've worked with Mr. Bales in the past on some of these PABs, and we've relinquished them to other jurisdictions. But because we have a potential project, it's set to expire by September, I believe. We have to have this done by September. A lot of paperwork, and it's paperwork. So, Stevens reviewed it. I'm going to have a resolution in the morning for you gentlemen to carry this forward. We'll get it off to Mr. Bales and actually do most of the work.
Perfect. Anything to add, Stephen?
I don't have anything to add, Commissioners. This is really, this is all put together by Kutak Rock, that law firm that really works on this stuff. So, I reviewed it just kind of like to see that it says what it says, and they're the ones really with the expertise on these issues, so I don't have any substantive comments.
I wish I'd have known that before Saturday, because between you and Public Health, we had like 3 different novels in our packet to read. Literally novels. But anyway, thanks. Appreciate that. I really don't have any questions. I think we had the discussion last time when we had these PABs that if anybody had a project going on in the community would like to keep the funds here locally. and it sounds like now we do, so. Commissioner, any questions?
No, that's good.
Okay,
It's good.
Thanks for your time, commissioners. We really appreciate you.
thank
Thanks
you
for
all.
coming.
Appreciate it.
All right. Have a great afternoon.
Have a great day. All right, Travis, we will go next to you again for this opioid settlement. And this will be Stephen and Travis.
I believe Stephen has probably looked this over. I think this is probably more ministerial than anything, because it's another settlement. We use SWORD, Southwest Opioid Response District, to manage all of our opioid funds, collaborate with other jurisdictions, and we just needed to have this memorandum of understanding was signed in 2021. I think it was when we created the SWORD.
Mm-hmm.
And so we just need to have a signature, and whatever settlement funds are going to go to SWORD. And we have to have this done by September 30th, but because we get all of this DocuSigns, it seems to drag on.
All those auto pins?
Auto pins, so just to get it out of the way.
Okay. Anything
Yeah,
else?
I don't have too much to add on this either. I mean, basically, if the board wants to continue participating in this and be eligible to receive any funds that are dispersed, you'd need to indicate so on, through this action.
Questions?
Yeah, pretty straightforward there.
Okay. All right, very good. All right, the beginning of the novels. Come on down, Miss
Yeah.
Locke. And good to see you, by the way. I haven't seen you for so long. I forgotten about you.
Forgot about me?
Well, no, not until Friday.
Travis, what order do you, okay, so,
We'll go with the IGA
You've
first.
got
you want to do that
IGA.
first? Okay, all right. Okay, the IGA with La Plata County. Yes, this was one of the many chapter novels. So basically what this is it's for the two public health agencies, for La Plata County Public Health and Montezuma County. Certain grants, certain funders, want regional work done. And so what instituted this IGA coming into play is a changing of the system in La Plata County, with being at La Plata County Public Health. Because historically we've done things together, but now that it's La Plata County Public Health, different leadership, different legal, so they wanted this put into place. We have a regional oral health coordinator who is funded by CDPHE. They historically fund that position to La Plata County, and then they serve the region for an oral health specialist. So who goes into the schools, mostly early childhood, and does prevention screenings, fluoride treatments, things like that on the young kids. We used to do that, but when we ended up with our permanent dental clinic with the 2 rooms, the ability for us to, we'd have to shut down our clinic there to go into the schools and do all that. So it's not feasible. There's not enough, we don't have the equipment, we don't have the staff to do that. So we used to rely on the regional oral health specialists. So that is why this agreement is in place, because of the changing of the system in La Plata County, and this position has been functioning and helping us out. Periodically the funding goes away and then it comes back. We have nothing to do with the funding. It's not someone who we hire. It is someone that's based out of La Plata County. So that's what the agreement is for, in particular for regional oral health. But this is sort of overarching, so say something else comes down the pipeline where it's something we could benefit from, but it has to be a regional approach, then again, we wouldn't have to come back and do another IGA. This serves public health in both counties to help with whatever it is that we need to do. We would obviously discuss what it is we're going to be doing, but the agreement would be in place at least.
So if we decided to move forward, or not we, but you all decided to move forward with something, it could be done under this IGA?
Yes.
Okay.
Yes. And Stephen has ad nauseum been working on this with the attorney in the Plata County too. So they've been going back and forth, and this is the final version that everybody agreed upon. So, because we've been doing this for a while.
Yeah, and I would just say, mostly restating what's been said, but this agreement is really like a framework in which to do more agreements. So this IGA opens the door basically to, as Bobbi said, future collaboration on different issues that come up with this framework in place for how our public health agencies are going to work together.
Yeah.
Questions? Okay.
Okay.
All right. Next will be
All
the
right.
amendment number 2 with CDPHE.
Yes. So this is basically our EBR contract, our emergency preparedness and response contract. They are only funding us for 75% of the budget this year. They tell us that supposedly we'll be getting 25% more. They don't know when or for sure if that's going to happen. So this is a reduction from historical. The maximum amount is $40,589. The start date on this, you'll see on the grant application, it says July 1 to June 30 of next year. Yes, this is the end of July. We had a contract amendment that covered for just the month of July, and so basically now we're starting with August 1st, even though the overarching contract is July through June. So the $40,589 is for the entire year. We are still advocating for ourselves with the state on this one, but there is going to be changes in the deliverables because we are only being funded at 75%. So we're not going to do the full amount of work if we're not going to get funded. So they are still working on the final version of what that scope of work looks like, and we will, if we have to prioritize, we're going to prioritize with what we have capacity to do. So.
Well, so they said that they think the 25% will come down the pipe, but really not sure.
They're saying they believe it will.
Okay.
This is Trent. Trent basically does our EPR program, so
Yeah.
I'm going to step aside and go ahead.
So most of the contacts in CDPHE believe pretty strongly that after the 1st of 2026 that they'll be able to furnish that other 25%. However, they'll make no guarantee because it's contingent upon what the federal entities want to go ahead and pass on. So again, there's been a corrected scope of work to achieve 75% of that. So will we get it, will we not? We're not sure, but we will prioritize what's most meaningful for our jurisdiction within our capabilities to deliver.
Of that 75%. So we're just patterning it after what we know we have in funding. Okay.
So and
Perfect.
seeing a red line version, I wasn't given a physical copy, but I was able to virtually see a red line version of the scope of work, and I believe it to be very achievable, the 75% that is outlined.
Okay. Very good. Questions, gentlemen?
No, I think we haven't hardly scratched the surface seeing a lot of this stuff yet.
Okay.
Yeah, and I believe a DocuSign was assigned to the chairman of the board to review your ledger.
We reassigned it to you.
Yeah, I know. Yeah.
But if you have questions at any time, you can feel free to call me on my cell phone or whatever. I'd be happy to discuss the details.
Yeah, I mean, just like normal, I can't sign those DocuSigns until after Tuesday's meetings. So when I get them on Wednesday morning and they expire and they expire and they expire, I don't, until we approve them, I don't sign any of them. So
Yeah.
perfect. I'll look at it when I get it and we'll sign it tomorrow if approved. All right, thanks.
Thank you.
All right, Bobbi, you're still here,
I am still here.
talking about Guardian Transportation and Security now.
Yes. Is that you? Okay. I hadn't met you before. Okay. Okay. So this is for secure transportation for Guardian Transport, and this must be Mr. David Hayes sitting here in the audience. So, and as you know, public health oversees this secure transportation program. So, and Mr. Hayes did a terrific job on gathering everything that we needed. So I'll kind of go through it. Yes, you have a lot of documents here, but I think I kept them fairly organized for you to look through. I'm just going to start by saying everything is present and accounted for, and everything is accurate. But I've gone through everything. He has the application for secure transportation licensing for the agency, and it's Class A restraints, which means that they can use restraints. It's not a Class B. This is a Class A. This is the first time we've had a Class A application. He's provided the list of staffing. He's provided a service map area of what the counties that he's going to be serving. He's paid the $400 fee that is for a 3-year license. He also provided the application for secure vehicle permits, and those are type 1 partition vehicles. There's a Dodge Charger, has provided the current insurance, mechanical evaluation inspection report, same for the Ford Explorer. I have current insurance, mechanical evaluation and inspection report, paid $100 per vehicle for a total of $200, and those are for 1-year permits. So he will have to renew in a year from the time you sign this. So that is everything in a nutshell for what he's applying for. And then the last documents that you have are the actual license and permits for each of the 2 vehicles, which if you approve it, you'll sign them tomorrow, and then Kim has to sign them as the clerk and put the license number and stuff on there. So that's what all of this paperwork is. Any questions about it?
A Dodge Charger is a transport vehicle?
I'm going to refer to Mr. Hayes. You want to come up and introduce yourself? Sure. Sure.
Hi guys, Dave Hayes with Guardian Transport and Security, and to answer your question, Dodge Charger is a fantastic vehicle for secure transports. Lots of room in them. Even with the partition, we have our partitions stretched so that they are more comfortable than typical law enforcement Chargers. They are state trooper cars, but they have all the safety features that are designed especially for this type of service, because somebody with a psychiatric event, you just never know when they're going to kind of come unglued and have a bad day. So it's a lot safer. We have a 100% safety record for all of our vehicles, and we actually have quite a few more living in Grand Junction. We are out of 12 counties is what we serve right now, adding lately La Plata, now Montezuma, soon Archuleta, and San Miguel. So if there's any questions and you'd like to see the car, we'd be happy to do that for you too. But they are very secure.
How many transports a year do we do? Or do you know? Any?
Oh, I'm sorry.
No, you're fine. I honestly don't know. My role is overseeing this process. After that, I could not give you numbers.
Gotcha.
I get no follow-up with these applicants. I don't know.
Okay.
So
Did
All right.
CIP do any of those transports?
they were permitted and licensed.
Yeah. Well, you don't know if they transported or not. I know
I
Southwest is
have
transporting
an
a lot
idea,
of
but I
patients.
wouldn't say that it's, I wouldn't count on that I'm accurate. So
Yeah.
I do believe they did, but I can't say for sure. So, yeah.
Okay.
Thanks.
All right. Thank you.
Okay. So tomorrow, if you approve it, then you'll sign it. Kim will do her signing, and then you'll get it back to me. So then I'll get it to Mr. Hayes. Okay. All right. Any other questions?
No.
Okay. All right.
No.
Thank you.
Thank you. Thank you both. All right. Planning. Mr. Haley, come on down, and we're going to talk about House Bill 241173 as it requires the counties with more than 20,000 to take a compliance action by December 31st of this year. So go ahead.
Yeah, so, honest, I have not read that whole bill, but per my email to Stephen and Travis, when that came out, planning would recommend to opt out and not add additional codes to our land use code. The likelihood is pretty slim that anybody would ever propose one of these things out in the county, but we have special use permits that are required for utility services for the public. So we can accommodate reviewing that under our current code. But that's my recommendation, is that we choose out. Maybe this one will stay on. I don't know if you have any questions or.
I don't think I have any questions. I remember when this was being talked about specifically, and most of it I think was targeting multifamily housing specifically, which is gonna, I don't think we have any real multifamily housing of complexes of 10 or 15 or greater in the county right now. It will probably affect more of the cities or bigger municipalities or counties, but I don't think at this point in time.
Right. So then we would have to have commercial zoning for multifamily housing. So at that point, that would need to be part of the discussion if that's what they were looking to
It
include.
doesn't mean that they can't put them in on their own. It just
Correct.
means that it's not a requirement.
Correct.
Okay. Questions? I think I kind of explained this to you guys last year when we were arguing this at CCI.
Yeah.
Cutting through more red tape that we don't have, so.
Yeah.
Okay. Do you have anything to add on this one, Stephen?
I guess maybe just to play devil's advocate a little bit to what Donna said. So the board has some options here on how to deal with this. You know, this House bill that was passed, I mean, I think from my perspective, the intent of the legislature is to, you know, promote uniformity across the state in terms of how these kinds of chargers would be permitted, right? So that people who are interested in developing these kinds of structures or services, whatever we want to call them, you know, they'd know how to do it basically, and they'd know what the standards are. And then I think also, I think another potential, you know, pro of adopting like this model ordinance or something similar would be that there would be some specific guidance about where and how development for this kind of use should occur throughout the county. I mean, I think that's why this bill was passed. You know, what the legislature would be hoping to promote within the state. You know, I think in my conversation with Don too, we talked about, you know, what might this look like for Montezuma County. I don't know if commissioners, if you've seen the EV charger station that went in recently by the city or Safeway, I think it is. You know, so that's an example of the kind of thing that we're talking about in part here with this proposal. You know, what standards might be appropriate for the development of those kinds of uses. And there's also a distinction in here about primary use charging and secondary use charging, that I think secondary use is more, at least from what I remember, was kind of like if there's multifamily housing or a business, and then someone wants to put some of these chargers as a secondary use to their primary use, which is something else, like a business or, you know, multifamily housing or something similar. And then a primary use EV charger project would really be like more along the lines of somebody
In-home.
builds something to be a electric vehicle charger at a certain location. And so I do think, I agree with Don that, you know, our land use code could accommodate these kinds of uses through our special use permit process. You know, and potentially high impact, I guess, depending on the scope of what would be proposed. Maybe I'll just stop there. That, you know, there is certainly a way for us to accommodate this. There's certainly one of the requirements in this bill is that we need to have some, you know, our code can't be more strict than what's proposed, and our code really isn't prohibitive of many things, as long as it's permitted in the zoning and it doesn't exceed the threshold standards. And then we've got the overlay of the permit processes to kind of evaluate each specific proposal on its merits. And so the staff recommendation is that we, you know, include this type of use in that structure. And so I just try to maybe draw out a little bit of the counter argument on that issue, but, you know.
So let me ask you this question. If we add it to the land use code, we just had 2 big developments down here that would have been perfect places to put it if they would have chose to put it there. It doesn't hamper anybody, it's just giving them basically the blueprint of what they have to do. That's it?
I think, you know, if the board were to adopt something, it would be just more explicit about, you know, these types of zonings, you know, accommodate this use. It would, right now they could call Don and talk about it, but it would be more uniform across the state, basically, explicitly, you know, how these uses are allowed or not allowed according to the model code that they've come up with.
But the power's got to be available too, right?
Power's got to be available.
Yeah.
So it's only going to be really concentrated where the
juice
where
is.
the infrastructure's
Yeah.
at. I don't.
And I would think that the state electrical code would take care of most of this.
I would think so too.
Yeah, I think, you know, there's some proposals in here about, you know, what's really within the scope of what the board should be reviewing or making standards about. And they have some examples about, you know, siting, and then also, you know, at the site, maybe some of the setbacks on the property, or how the striping works, you know, some of the more real minute, like some of the real fine details. I think it's envisioned the county would have some say-so in crafting what these things look like. But in general, it's not the case that like a proponent is like inventing this system. I mean, these are like set, I don't even know how to explain it really, but set charger technologies that are purchased from the people who make them and then install them, right? And so there are certain safeguards as to, you know, their safety and how they operate. And then what's really proposed to be within the scope of the board is some of the finer details about how this fits into the county's, you know, permitting infrastructure and some of the particularities about what exactly these stations or projects would look like at a very fine level of detail.
I mean, the technology in these things is so changing so fast that, I mean, you got level 1, 2, and 3 chargers now, and your level 3 charger is your fast charger. But there's stuff on the horizon that's going to allow you to charge fully in 15 minutes.
There's a demand rate for you.
Yeah, there's a demand
Well,
rate.
what's coming is pretty neat, you know. Instead of lithium-ion battery, they're talking about aluminum-ion batteries, which greatly reduce all the risks and increase the charging times tremendously. and extend the range from like 300 miles to 3,000 miles?
I guess we don't need a charging station then.
I think this is.
Sounds
I
like
think
it's
this-
covered if you go coast to coast.
This was set up as a permissive bill anyway, so it doesn't mean that you have to adopt it now. It doesn't mean you can adopt it later, just because they just want something that says, are we going to or not now?
You know, that, I mean, in the bigger picture, uniformity in the state of Colorado is, I mean, that's as close to oxymoron as you can get.
Yeah, it looks to me like it's just the Front Range dictating what we're supposed to look at.
What comes to mind is written in Denver, by Denver, for Denver.
I don't, well,
Well, just Commissioner Candelaria, just to answer your specific question, right? What the board needs to do by December 31st is either adopt the standards from the model code, adopt the standards in the legislation, or just adopt a resolution or ordinance saying that the board doesn't wish to change the existing land use code and not revise the code before December 31st, 2025. So it doesn't preclude some later amendment. We just need to deal with the passage of this bill and take some kind of an action from those options by the end of the year.
so I'll wait for a conversation that hopefully we can have in the next 20 minutes, and we'll make a decision tomorrow anyway, since we have someone coming. Okay?
Yeah.
All right, thanks.
All right, thanks, Don. Robert Dobry next. Sounds like we have our audit back.
Yes, we do have our 2024 basic financial statements, our audit. I just wanted to highlight a couple things as I present this to you. One, just to skip to the most important part. There were no audit findings, and therefore no corrective action plan is necessary. So we have a clean audit. That's on page 76, and that really is the most important part of our audit. The other thing that I wanted to just highlight to you is something that really relates to our projections of revenue. We are very conservative in our projections of revenue. In 2024, we projected about $400,000 of investment revenue. We received $1.4 million of investment revenue. That is it's something that we've known that we are a ways off on that, and we have really taken some action basically just to look at the previous year and tighten that up a little bit to give us a little bit of a clearer picture of how much revenue we're going to have. So for instance, for 2025, we budgeted $1.2 million of investment revenue. And then the audit, after the commissioners approve accept the audit tomorrow, will be submitted to DOLA at the state, and then also be available for the community on our website. So it's under our finances, so you can look at all of our past audits. I think probably the last 4 or 5 are on there. And then if you had any questions, I'm happy to answer them.
I don't have any.
No.
Commissioner? I mean, not that we won't have any, but not at this point in time, I don't have
Okay.
any.
All right.
All right.
Well, thank you very much.
Thank you, Robert. Okay, Stephen, we're going to move right along. Looks like we now have a resolution for this exemption for 184 and 25.
Yes, so this is, Commissioners, you may recall, we've discussed this a few times here. This is a proposed road realignment that the County Road Department would like to accomplish. I think it had kind of been sketched out by the Road Department, but we had to get planning involved and also myself to kind of put this down to paper here and talk about what exactly we want to achieve. So I've drafted this resolution pursuant to the exemption process in the county's land use code to create this parcel essentially that has been proposed to be purchased by the county. And that is for the purposes of realigning that intersection to make it parallel with the intersection of the road to the north.
184.
Yeah, on 184.
and the Heritage Center.
Right, at the Heritage Center, exactly. Right now, it's a little staggered. And I think there's a hill also that makes this not a great intersection currently. And so this is the resolution I've prepared. Basically, it attaches this exhibit, which is the plat that we had done. If you could go to that, Travis, you just had it up as a PDF. Yeah, so this is the parcel that we would be creating pursuant to the exemption process in our land use code. Basically, that this division of land is not, should not be governed by the county subdivision regulations. That's not the kind of use we're envisioning here for the creation of this parcel. And then I've inserted some language in that resolution to just say that the county would be authorized to work with the landowner towards purchase of that property. So we've circulated a draft deed. Basically, the road department negotiated the proposed purchase price of $30,000 for this parcel, and I've run it back through both planning and the road department, and the road department reports that this piece of property would be sufficient for the road realignment that they want to do here. And also the reason why they want to purchase the property is because of the realignment. It would really create just a tiny sliver on the other side of the road that wouldn't really be able to be used for anything by the landowner, but it could be used by the county in the future as well for staging vehicles for road maintenance and things like that. So the road department's on board, and so is planning.
Okay, and this is still the 2.1, it still equals that 2.1 acres, correct?
Do you know what the exact size is?
Oh.
Yeah, 2.2.
Okay.
Yep.
All right. And then we'll own all of that, so if they do want to stage anything, they can stage it out there, so, okay. Questions? So once we get this purchased, then we have everything to move forward with it at that point in time.
Yeah, the reason I did it this way is this would come before the board tomorrow for a decision, and then if the board approves it, staff would have the authority through the language in the resolution to continue working with the property owner and execute that purchase. So that doesn't need to come back before the board again, on something that's really been approved already.
Right, and then we can hopefully go to add this winter and get it put into place next spring.
Yes.
Okay. And then this would then complete all the requirements for CDOT, so 25 Road can still add the additional development on it that may or may not take place. Okay. Perfect. All right, moving right along. Stephen, we have another transfer, and this must be
Yes.
for the sliver.
This is the sliver, that's correct. So the board may recall there was a land transfer done, similar to the one that we just discussed, where there were some different moving parts. This is the 2012 resolution. Thank you, Travis. And this county road was realigned out by Narragansett, a parcel. There were some different moving parts. I think some of the land was originally owned by the federal government. Some of that was provided to the county. And the intent was to give a certain amount of this land to the property owner because the county was getting some land in return to realign this road. But one of those pieces that were in the mix was never deeded to the property owner here, the Paul Dunn Family Trust. And so I've drafted this proposed resolution that just kind of lays out that this is what we did. In 2012, this was the intent. For whatever reason, it was never executed properly. And so, I've been working with the assessor's office to make sure we've got the right language now. And so we've got an exhibit to this resolution with the legal description here. I think this is the complete property that was intended to be conveyed, and then I've got a draft warranty deed that could be signed to transfer that remaining parcel that we had originally intended to convey, and just for whatever reason it had never been effectuated.
Question?
No.
Pretty straightforward and simple.
Yeah, easy.
Okay. All right. Anything else, gentlemen? All right, with that, we've come to the end of our agenda, and we are adjourned. Thank you all.